So I think that the issue with trying to niche down too soon is, had I jumped into implants right from the start, well, I'm actually a better implant surgeon now because I understand chronic pain. I understand the forces going through my implants, forces going through my implant prosthodontics, and I know how to deal with them.
Find your niche. Now, that's a saying that's probably been bandied around a lot in all the sort of circles of career advice. It's something that I heard a lot early on in my career, and it never fully made sense to me. I'm hoping it's going to be this episode that's going to make the whole concept of finding your niche tangible. What are the benefits of finding a niche, how to go about it, and what does it actually mean? Now, I'm joined by someone who is quite inspirational for this episode because he's someone who's quite openly admitted to failure in some ways, and I do believe failure makes you stronger, and we talk about some struggles and failures early on in his career. And I'm very honored that Dr. Pav Khaire shared those failures with us because that's how we can learn about others' experiences. It's not all rosy out there. And with that failure or with the struggles, he was forced into trying different procedures, trying to boost the revenue for the practice. And through all that, eventually, he found his niche and then he changed his niche. So he is a living example of no matter how qualified, how many years of experience you have, that if you still are looking for that right niche for you within dentistry, then the opportunity is still there. And if you're at the very early start of your career, just use this episode, use the lessons from Dr. Pav Khaire as an inspiration to helping you finding your next steps and your niche. Protrusive, I'm joined by Dr. Pav Khaire from the Dental Implant Podcast to talk about his niching down into implants, my fears about dabbling into implants and my challenges in terms of getting started with implants, and the recipe to finding your own niche, whatever that may be for you. So the very relevant protrusive dental pearl I have for you today is to sit down and maybe at the end of this episode, just take 5 minutes to get a pen and paper and write down all the procedures that you like to do, all the procedures that you'd like to do more of and get known for. Now, I don't mean like an Instagram celebrity or anything like that. What I mean by that is someone who your colleagues, who your peers respect, because you are the go-to person for that procedure. And it doesn't even have to be in Europe, in the UK, in the world, whatever. It can be in your town. If you can be known in your town for a certain procedure, then that itself can carry so much success. So there's so many benefits as we discuss about finding your niche. And I want you to make a list of all the things that you like doing or that you like to do more of and you want to be known for. And also make a list of the procedures that you just fell out of love with, or you don't enjoy doing, or you're not very good at for whatever reason, and either decide that you're not going to do those anymore, or decide to upskill in that. Because part of finding your niche, as we discussed in your episode, is becoming comfortable in your skin that you're not going to be doing all the procedures, and you don't have to provide all procedures. So it's an interesting topic. I hope you find it very useful. Let's join Dr. Pav now. Let's not waste any time, and I'll catch you in the outro. Pav, how you doing, mate?
I'm good. It's I'm about to start work at Evo, so I'm not doing surgery today, which is really strange because normally I do surgery if I'm here 4 days a week, I normally do surgery at least 3 if not 4 days a week. So coming in on a Monday not having surgery, I'm just like, wow, okay, that's weird. But yeah.
What have you got planned today? What's the kind of agenda for treatments today?
It's just review appointments and consults basically. So it's one of my other colleagues, he's doing the surgery today. And then I've got some pretty interesting cases lined up for the rest of the week. So yeah, it's good, yeah.
Amazing. Well, for those who don't know Pav, I'm going to give my little introduction before you can do your official one. But Pav is the host of the Dental Implant Podcast, and he is a friend that goes back. I'd say a large proportion of why I started to really get involved with occlusion and splint therapy and AMSAs was because of you. We invited you to our study club back, about 7 years ago now, and you came in London and you just inspired me so much. I think you remember that night, right?
I do remember it, yes.
So you set something off at that time, my friend. So it's great to have you on the show today because you were an important cog in my journey and really important mentor, if you like. So it's been great to see how you have niched into implants since then, and what a great way to introduce the theme of today's episode, which is niching down, or if you're in the US or somewhere else, niching down, which just sounds wrong. But Pav, tell us who you are for those listening around the world, and you're about your new journey as a podcaster as well. Before we dive into the nitty gritty.
Yeah, so it's for those listening to my podcast. This is welcome to the next episode of the Dental Implant Podcast. And Jazz, I just want to say, apologies for sucking you into the black hole of chronic pain. You know, it's a weird journey, but yeah, I do actually remember that evening a lot, and you were asking all the right questions, and I remember thinking to myself at the time, I was like, he gets it. I was like, he's going to go far with this. And similarly, I think we spoke a few months ago, and you basically turned around and said to me, Pav, you've got a lot of information. Why don't you set up a podcast? So in that context, you're my mentor. You know, you're giving me advice on how to set things up. So a little bit of background about myself. I graduated in 2002 from Guy's Hospital. I purchased my own private practice in, I think it was 2004, 2005. Struggled along with it for the best part of 9 years. Ended up having to close the business. As well as closing the business, because I'd given a personal guarantee on it, I ended up going bankrupt as a result as well. After that, it was just like, because I've received bad business advice from a lot of people as well.
Can you give us an example? I mean, generic bad. What is an example of bad business advice, if you don't mind?
So a generic example of bad business advice, and this had happened to me, where people are turning around and saying to you, you can turn your business around, just do this, this, and this. Keep paying me, I'll keep telling you what to do. Whereas what they should have done, and what the law says they should have done, is looked at my books and turned around and says, I'm sorry, your business is insolvent, you should pull the plug. And it was actually an external person who came, who ended up, she was actually a patient of mine, and I can't remember how we got onto this subject, but I told her that the business was struggling, and she goes, well, you know, that I'm in finance, do you want me to look at the books? And I looked at her, and she just came back to me, and she turned around and said, you know what? She goes, you need to pull the plug. She goes, whether you want to hear it or not, she said, you're going to lose this business at some point. She goes, you're going to be better off doing it sooner rather than later. And I said to her, but, you know, my business coaches were telling me it's okay, you know, they'll be able to turn the business around. And she goes, I don't know who's told you that, but she goes, that's not appropriate advice.
Wow.
So it's, and that's when I realized that I was much more comfortable as a clinician as opposed to a business owner. Some people thrive as business owners, you know, and I've got great friends where, you know, they own practices and they're exceptionally busy, exceptionally successful. It just wasn't for me, you know, in terms of clinical work. I was far, far, far more comfortable in that.
I would definitely say I'm the same, Pav. I mean, I get asked all the time, Jazz, when you open your practice, and I guess, you know, it's something that I've really thought hard about, but I feel exactly the same as you. I feel like I love my clinical dentistry and other pursuits and passions. So to devote my time to all the stressful yet rewarding activities of a thriving business owner, multiple practices, that kind of stuff, it's just not for me. And sometimes self-realization is such a huge proponent in your success in the future, and knowing what you actually like.
I think the flip side to that coin, because there's a silver lining in every cloud, Jazz, is because I had a business which was struggling, I was constantly, you know, I need to bring more income into the business. I need to bring more income. So I was learning a lot. So I had a lot of training in fixed removable prosthodontics. I did a lot of training in the US with Frank Spear. I was one of the first to implement 6-month smiles in the UK. And in fact, the guy who said he was the first to implement 6-month smiles in the UK, he was on the same course that I was. So, you know, and I went down the ortho route. As you know, I went down the chronic pain route for quite a few years for S4S. I could do full mouth reconstructions, IV sedation. But what I found is I was getting bored clinically quite a lot. You know, as I'd start.
But why? You had so many different variations. Like you just mentioned all those things, and it ties in so perfectly. One of my main questions, which I think I can just ask now because it's perfect timing, is being the jack of all trades, which sounds like you were. You were doing your sedation, ortho, complex reconstructions, fix and removal. That is, for me, the super GP, right? Super GP territory. So why not have that? And why then eventually decide to niche down?
Well, for example, when I was doing full mouth reconstructive work, either an arch or a full mouth, when you first start doing it, there's this rush, there's this, oh, you know, I need to learn this, I need to do it this way. And then it gets to a point where you're proficient at it. Now, I'm not saying all cases are easy, but you end up almost going through the motions a little bit. And you're like, okay, as long as I follow these steps, I know I'm going to have a predictable result. And the only thing that really started to capture my interest, and this is ironic actually where I am now, is when I first started, I was like, I'm not doing surgery, I hate surgery, I'm not going near implants, I'll restore them, but I'm not placing them, because I was afraid of surgery, because I didn't have the clinical knowledge and the experience. Mm-hmm. And after a while, when I got bored with the rest of it, I was like, okay, let me do an implant course. And well, it just took off from there. I started to realize quite quickly, well, the reason why I like implants is you do actually have to think of the restorative. You've got to think of the perio. There's a lot of times you've got to think of ortho. So for me, implant dentistry is actually all-encompassing. It encompasses everything that I've learned so far. And for me, it was just a natural progression to start to niche down into implants, because I found more than anything else, that is what I loved. And I think we hear this a lot, and we don't take it on board, in that a lot of people hear you can't be a master of all trades. You can be relatively proficient at a number of different things, but it takes a long time to become extremely proficient, even in one thing. So to multiply that out becomes very, very difficult. Now, I'm not saying that there aren't people out there who are supremely proficient at a lot of different things, because obviously there are people out there. But what happened for myself is I just got to the point where I enjoyed implants so much, I started to progress more down that route. I was doing more courses, ended up doing my master's degree, and it's like a natural progression in anything. So what ended up happening is I was only doing implants in my practice, then I was branching out and doing implants in other practices. And quite recently, about 10 months ago, I got very lucky and landed on my feet, because I joined the team at Evo Dental. Now, if you think placing just implants is niche, well, at Evo Dental, all we do is treat full arches and full mouths. So my typical day is a dual arch, 10 implants, and we do that. We do that 5 days a week. So for me, it was almost like a natural progression, moving from boredom and necessity to bring more income into the practice to all of a sudden finding something that I love and starting to expand those skills. And the niche kind of like developed itself. I did, as I said, I was lucky. I've ended up at Evo, but it was just a natural progression that I was doing more and more implants.
Thanks so much for that very honest reflection on how it started in terms of the necessity to keep your business running afloat and having to dabble in different skills and upskill yourself, and eventually almost by accident landing into implants because you felt, okay, let me try a course, and then just took off from there. Yeah. I guess to use an analogy, you had to kiss many frogs before you found your prince. But then yes. What would you give, what advice would you give to young dentists, a couple of years qualified, which they hear this advice, right? And I'm hoping in this episode, Pav, we're going to make it really tangible, because you hear this all the time. The guru is always saying, find your niche, find your niche. But if there's no predictable formula to find your niche, like you might just accidentally fall upon it. You might have a mentor that inspires you. So I do feel as though, how can you find your niche if you haven't given it a chance? Like my niche might be endo, and I haven't discovered it yet because I haven't given endo a chance. So what would you give to someone first 5 years qualified, or even dental students, or in that sort of young dentist category, to help them find their niche?
Some people will never actually develop a niche. They'll be quite comfortable in general dentistry. But the other thing I would say is, don't rush into trying to find a niche too soon. Let's go back a step. This is actually what happened to me. I was like, okay, my niche is going to be cosmetic dentistry. It's going to be veneers. It's going to be full mouth reconstruction. Then it's like, okay, well, that didn't work. Now my niche is going to be orthodontics. And then after orthodontics, that's when splint therapy came out. And I naturally just progressed into implants. Now, there are some people where they're just like, I want to become a specialist. That's great, go for it, okay? But if you're in general practice, it's important to expand your skills and learn more, and you'll just get a natural affinity to one thing above anything else, is what I think happens. So I think that the issue with trying to niche down too soon is, had I jumped into implants right from the start, well, I'm actually a better implant surgeon now, because I understand chronic pain. I understand the forces going through my implants, forces going through my implant prosthodontics, and I know how to deal with them. I also understand orthodontically, even though I don't do the ortho, I understand orthodontically what can and cannot be achieved and how it can improve my implant outcomes. And because of the restorative work that I've done and the training that I've had, I understand occlusion as well. Now, you and I, we've both sat with Riaz Yar, And he understands occlusion to a much higher level than what either of us do, but he's a specialist. And so this is the benefit of not niching too soon, is that it gives you much better rounded ability when you do actually start to niche down. For example, some of the better endodontists that I know, they also like placing implants, and they can make that judgment call better as to whether a tooth can be restored or whether it should be doing implants. Now, even within implant dentistry, it's really important to understand there's different niches in implant dentistry, okay? When you first start, we always recommend placing implants out of the aesthetic zone towards the back and field ridges, okay? Then you can start to build up your proficiency in immediate implants. Then you can start to build up your proficiency in grafting, and grafting is not easy. People think, you slap on a little bit of bone, membrane, you're great to go. It really isn't easy. There's different ways of doing it. There's different indications for different methods, and it's not always predictable. And so you need to understand how that is. So I know some people where they will build a niche within implant dentistry and within the subtopic of grafting. And then obviously my niche at the moment is not even just within implants, it's within full arch reconstruction, because that's what we do here all day, every day. And it's just been a natural progression for me. So the advice that I would give to the younger dentists is, A, don't be in a rush, but I understand why you feel you want to be in a rush. I was in the same situation as you as well. I was like, I want to do this, I want to do it now, okay? I see a lot of people, as soon as they're coming out of university, they're like, I'm going to be a celebrity cosmetic dentist. There are people out there, I've been graduated since 2002, so that's coming up to 20 years. I'm very good at my aesthetic work. There are people out there who will just walk circles around me because they have niched down and they're so highly proficient. So what I was expressing is to the younger colleagues is I understand why you want to niche early. Sometimes it'll work out, sometimes it won't, but have that flexibility that if you start to do something, you're finding out you're not enjoying it, you can shift into something else. That's what's happened to me. It sounds like that's what's happened to you on a couple of occasions as well. It is really satisfying when you find that thing that you really love. Yeah. So the benefits to our patients, because we're focused only on full arch implants, is we end up being very proficient at it, and we can intercept problems before they actually cause problems, because you're just exposed to it all the time. If you're doing 1 or 2 arches or 1 or 2 full mouths per year, you're not going to build up that muscle memory in order to be able to really help these patients. When you do it day in, day out, you're immersed in it. And this is what happened when I started at Evo Dental, is I started right at the beginning of the training pathway, and I was just immersed in it with my mentor. And I progressed really quite quickly because I had the background in implants already. But you find that muscle memory builds up really quickly when you're doing it all day, every day. So you need those 10,000 hours. You need a good amount of time and exposure to it to be able to build up that muscle memory.
I think the 2 takeaway points and reflections from what you just said there was A, not to rush, and B, be open to the opportunities for learning that are out there, and eventually you'll automatically be attracted. Like, for example, Rina Wadia once told me when we were having the similar discussion about 7 years ago, she was saying that automatically when you get the dental update in the post or the BDJ, you'll automatically start flicking to the pages that interest you just subconsciously, and you'll slowly, just through the forces of nature, start to find the affinity towards that micro speciality. And I guess this was echoed to me by a periodontists saying that try and become the best person in composites or the best person in perio. Be the go-to guy for sedation. Yeah. And I think there is a lot of power in that. Like, you are becoming the go-to. You were definitely the go-to guy for splints, and now you're definitely the go-to guy. I think you're emerging in a full arch implant case. I love your passion. I know you've studied so hard, extra qualification stuff. So it's great to see you blossom. And I think it's great that you have that story, because it's inspiring to young dentists who maybe feel as though they can't change their niche too far down that rabbit hole. It's not the case. You're a living example of that you're 20 years qualified, but you're not slowing down anytime soon, right? You're still exploring this niche that you found, and it wasn't something that you had from day one. So that's epic. And one more saying that I've thought of is the riches are in the niches. So obviously it's niches, but to make it all work, the riches are in the niches. And I truly believe that once you can be the go-to person for that one field, you'll be rewarded for it.
I think there's two sides to that sword, but you're absolutely right. My training, my passion hasn't slowed down at all. So the next stage of training for me is zygomatics. So I'm already in the process of being trained for zygomatics. I've done some courses. And at Evo Dental, we've got one of the most experienced zygomatic surgeons on the planet joining the team next month. So my mentoring is going to be done directly under his supervision. So even within the niche of full arches, there is another subset niche. You can just keep going and going with this. So I think the upside to it is when you start to niche down, there are few people who can, from a business point of view, who can start to compete with you, okay? But what I was saying about that dual-edged sword, the other issue is a lot of people don't understand it, so you won't get the referrals, but the patients don't understand. I mean, let me give you an example, Jazz, is as well as what I do, is that, we can turn around and say to patients, we don't care if you've had migraines for 20 years, there's a solid chance we'll be able to get rid of them. They don't believe you. And so generating that marketing to push to patients so that they understand that we can help them, because they've never heard of it, and quite often these patients have tried everything under the moon. They just think it's another way to scam them, basically. So the upside to niche is you have a very strong skill set, which very few people can compete with. But the downside to niching is fewer people have heard of what you do, so it's harder to generate that business. But once the momentum of that locomotive starts, then it's hard to stop. It takes time, it takes effort. So anybody who's listening needs to understand. It may take you 5, 10, 15, 20 years, but don't expect it to happen overnight. There was an old saying, I can't remember who it was, and I think it was a singer, and if you're all of a sudden within the space of 4 or 6 months became extreme, like world famous. And people said, I remember reading in an interview, somebody turned around and said to him, how does it feel to deal with this overnight success? And he said, this overnight success I've been working on for 20 years. So it takes time to build. And people are in a rush nowadays. The world doesn't work like that. Keep working hard, keep studying, you'll eventually get there. And if you don't want to niche and you're quite happy doing general dentistry, great, that's a niche in itself.
I was waiting for that message because that is so important, because a lot of people don't want to niche down to a specific area and they love the variety. They look at their day list, they have children, they have some perio, they maybe have an implant in a premolar region, they have a root canal, and they love that and they're great, and that's good. So that itself, it should be respected. It's great to have that. And you can market yourself more widely, which is a great point you made about a downside of niching down. I think the two themes that we need to explore in the next 15, 20 minutes or so is if you start niching down, the fact that you have to become comfortable to not doing molar endo anymore. For example, like let's say I'm niching down into implants, like as you have, I need to build that muscle memory, and therefore I'll be doing less of endo. I'll be doing less of some other procedures, basically. And then it doesn't make you any less of a dentist because you won't be able to do that stuff anymore. And you have to be comfortable with that. And I want to hear your take on that. And then B, let's talk specifically then about niching down into implants for the young dentist, because I can share some experiences and some reasons why I am hesitant to start dabbling in implants, because I feel as though I need to go all in if I do implants. So we'll discuss that theme as well. But let's start with that first one, is about being comfortable in your skin, that you now can limit the procedures that you do.
It's very hard to start with, because the first place it's going to hit you is your wallet. When you are trying to increase your skin in something but you're not very proficient at it, to start with, it takes a lot of time to be able to do even the simple stuff. And to dedicate that time, you've got to drop down other stuff which is bringing you in income. So the first place it's going to hit you is your wallet, but you just have to be comfortable with it. So when I owned my practice, I did actually own a microscope. I was actually pretty damn good at endo, but then I ended up having to sell my microscope to try to keep the business afloat. And I found out very quickly, I can't do endo anymore. And then I ended up referring all of my molar endo out. And then very shortly I was referring all my molar and premolar endo out. And not too long after that, it was just like, you know what, I don't want to do any endo whatsoever. And that then starts to free up your time. So it's important to realize that because it takes time, it has to start with that passion. Because if it doesn't start with that passion, you're just going to turn around and say, I'm sorry, I'm not prepared to drop this income. And it will impact your income to start with. It just naturally does. But then what happens, like, for example, because I've been doing implants for a long time now, if I get a very straightforward implant case, and they're not all like this, if I get a very straightforward implant, let's say single implant, when I first started placing implants, it may have taken me 3 hours to do that case. I can now do it in 12 minutes. You know, I think the fastest I've placed an implant from the patient coming in to the patient leaving is about 8 minutes, including anaesthetic. But I didn't get to that position overnight. When I first started at Evo, my average length of time that it took me to do a dual arch was about 5 hours, 5.5 hours. Now my average length of time is just under 3 hours, and that's good. More complex cases that can take a little bit longer, you know, straightforward cases, 2.5 hours. But that didn't happen overnight. That happened because I was immersed to it every single day. I had a mentor sat on my shoulder saying, Pav, don't do it this way, do it this way. You're going to get a more predictable result. It takes time. And you have to be able to let go of what doesn't interest you to grab hold of what does interest you. You know, you can't hold on to two things with this thing pulling this way and this thing pulling this way. It doesn't work. At some point, you have to let go of this vine to swing further on this vine.
Well said. Great analogy, and I think a lot of people needed to hear that. Actually, it's really important to hear that message. As you know, you otherwise you're completely oblivious, or like you said, if you don't have that passion, only then does the decrease in income really start eating at you. But when you know there's a purpose and an endpoint, and you're trying to upskill in other areas, which will hopefully reap rewards in the future, then you can be comfortable with that drop in income.
Sorry, I was just going to say, Jazz, one of the rewards that's come from me from niching into implants, and not even just dabbling in it a little bit, but really studying and grafting hard at it, is I'm now in a position where my skills and my knowledge are indispensable to the practice that I work at Evo. So it's actually job security for me, you know. Mm-hmm. It's when you have that niche, it actually improves your job security as well.
Absolutely. With implants now, I have dabbled. I placed a few under some mentorship and guidance, and I just felt as though there were so many complications. Surgical complications, technical complications, restorative complications, things like cold welding, which I never knew existed, and it happens to you. Things like a screw being over-tightened, now you can't unscrew it. Things like someone comes in, and you see it on Facebook all the time, which implant is this? Oh, I have a patient in Ealing, and they have this type of implant. And there's so many different brands that I just feel there are so many challenges, and I mean, you know, you're the best person to advise me, but the learning curve for implants is steeper than I've seen in any others. And this is from actually placing and going through that sort of procedure. But what people tell me is that to place an implant is easy. Just, you know, the actual procedure is easy. But it's nothing simple about the overall overarching concept when it comes to healing as well and patient selection. But restoratively, the more complex you get and the more challenges you are faced, it's very, very difficult to perfect it. So what would you say to someone who maybe, because I hear this from young dentists all the time, that, you know what, I don't want to get into implants because it just seems like way too crazy for me?
So what I would say to that is there's two things that I want to address. Don't be afraid of implants. You know, I'm living testimony that, you know, it can be learned. You know, I wasn't born with this knowledge. I wasn't born with this skill set. It's taken me time to develop it. That means that it's cost me a lot of money in terms of education. It's cost me a lot of money in terms of equipment. And it's cost me even more money in terms of mistakes. This is why I keep hammering on about mentors, because when you start doing this type of work, and particularly more complex that it starts to become, is you're either going to pay to fix your own mistakes or you're going to pay to a mentor to avoid those mistakes. But one ends up with a happy outcome, but you're still going to pay one way or another. I think the other side of the coin as well is, and I see this a lot, where people are like, okay, I'm going to do a 1-year course on implants. I'm going to do 1 day a month over 12 months, and I'll be able to do full arches. I will be able to do absolutely everything. I will be able to do this. I'll be able to do that. It doesn't work like that. It's significantly more complicated than that. Okay, like you said, is, you know, choosing your implant system. then you need to learn how to use that implant system. Then you need to understand the biology of patients. We're talking about things like gut bacteria, which can affect healing, psychological stress that can affect healing, vitamin D, we are talking antidepressant use, we're talking proton pump inhibitors. All of this stuff adds up. And so a straightforward implant case isn't actually a straightforward implant case. So what I would say is don't be overly daunted about starting, but understand that what's not going to happen is you're not going to do a 1-year implant course and be able to do everything. Like what people say with regards to your BDS, once you've done 5 years at university, you've got your BDS. That doesn't mean you're a good dentist. It's a license to start learning. Once you've done your basic implant course, that's a license to then start learning. I still go on courses. I'm still learning lots. I still read papers every single day. So what I would say is the journey of 1,000 miles starts with a single step. So you have to take that first step, but also understand that it's not going to be done overnight. You're not going to get to the end of a 1-year course and all of a sudden be proficient. And the other thing that I hear as well, and this happens a lot in America, where people are like, oh, I'll go to the Dominican Republic for a week, I'll place 50 implants in a week, and that's going to make me a great surgeon. No, because you don't have the follow-up of those patients. You don't see the mistakes. I've still got cases from a few years ago where I'm only just fixing now, which have cost me an absolute arm and leg because I thought I was proficient with full arches. I did a full arch. It didn't go according to plan. The patient's not going to pay you again. And this is what I said in my last podcast as well, Jazz, in that, is if you do an MO restoration on a lower 6 and it breaks, or find the patient comes in, patient's not particularly happy, you can redo the MO restoration. Now imagine what happens when you do a 6-unit implant retained bridge and you put in 3 or 4 implants, and that doesn't work, and all of a sudden one of your implants is fractured. Correcting that is significantly more complicated, and it costs you a lot more money out of your own pocket.
That's exactly what I mean, Pav. It becomes more complex, but then the failures also become way more complex, way more stressful, which is why some dentists are saying, you know what, I'm not ready for that. But I think what I'm trying to say is there a place for dabbling in implants? You know what I mean? Yeah, God, tell us, can you just do the odd, 1 implant a month to replace a lower molar and then keep it at that?
Some of the most successful dentists, and these are the ones where they're general dentists, they do quite a lot of different things. And what they will do very, very successfully is they'll do an implant course and they will cherry pick and choose the easy cases. The more complex cases, they will either refer out or they'll get somebody into the practice to do it for them. Just because it's the same as ortho, Jazz. If you're doing orthodontics, there's a very big difference between, we're going to do short-term ortho because the patient's had a little bit of relapse. Everything towards the back is fine. I know that this is within my skill set. We can get it done in about 6 months. Okay. Versus, this patient is an orthognathic surgery patient. You don't do an ortho course and all of a sudden start doing orthognathic surgery cases. And it's the same with implants. You can do healed ridges towards the back of the mouth. What's the most commonly removed tooth in the mouth? It's upper and lower first molars because they've been in the mouth for longer. They've had more dentistry done to them. So if you've got a lower molar that's missing, there's a ton of bone and it's a healed ridge, absolutely go for it. There's a lot of business to be done, and it's less stress as well, Jazz, because it's out of the smile line. It's nothing complicated. And then if you get something in that needs a sinus lift, get somebody in or refer the patient out. The patients will actually respect you more if you turn around and say to them, look, I can't do this for you because it's more complicated, but I know a guy who can.
I think that's a great message for those who like me sometimes think, is it worth it? But if you do, just like they do on the ortho courses, you start with your class 1 based relapse cases, or in the implant world, the sort of analogy would be, or the similarity would be a lower and upper first molar out of the smile zone, and build from there. You never know. That might be something that interests you more and more, and then you end up doing more courses, soft tissue courses, moving to anterior, or you might just stay as keeping that as part of your larger skill set, and then you can do that, but you have people to refer to. So I think that really does help, actually, and I'm hoping that's going to help a lot of people listening as well, in terms of who are afraid, young dentists who are afraid to get involved with implants because they know that the field can be famous for, or infamous even for, its complexities and litigation, or the justifying the higher fees of indemnity. Because the flip side of that, Pav, and I'm sure you know loads of these, is people who have done the 1-year course for implants, or people who've done an MSc and then never went on to place an implant again?
Yeah, I hear it all the time. When people do MSc, they've placed 4 or 5 implants, and they still need mentoring, or they just don't do it because they haven't built up that confidence. Okay, let's say somebody starts placing the simple implants, and all of a sudden they want to progress, and they think, right, the next thing for me to do is to learn how to do sinus lifting. Well, sinus lifting is complex in itself. So first you've got to go on a sinus lifting course, which is going to cost you £3,500. You've then got to get the sinus lift kit, and there's different lifts for different indications. Then you need to go to your indemnity. The indemnity is going to turn around and say to you, right, as soon as you're going into sinuses, right, we're adding £2,500 onto your premium. And if you're doing 1 or 2 lifts per year, is it really worth it? Whereas if, like what we do at Evo, you're going into the sinus 2, 3, 4 times a week, then obviously it is worth it. And you build up that skill set. There is no harm at any point turning around and saying, I'm comfortable with this level, I don't want to go beyond this, but I'm going to get better at this level. And then when you start to find a niche, is that bubbles just automatically start to grow as you think to yourself, well, actually, I am seeing enough patients to be able for me to warrant doing sinus lifts and learning about them and adding them to my fee, because I'm having to refer 3 or 4 out per month. Then that's obviously a different ballgame. But don't be afraid to start the journey, but just don't also be naive to think to yourself. This is an issue, Jazz, is because the way that I look at it is how many courses would sell is if the people who are running the courses turn around and say to you, well, actually, you know what, we're going to charge you X amount, but by the time you get to the end of it, you're only going to be able to do the really simple cases. There's a little bit of embellishment. I'm not saying people are being malicious about it, but people want to run these courses, and these courses are sponsored by implant companies. And these implant companies, they're going to want you to buy their implant systems. There's pros and cons to each implant system. You need to understand what you're buying and make sure that you understand the data so that you're comfortable with it. I did a podcast with Bill Schaefer a few weeks ago. This is one of the things that we were saying. There are some really crappy implant systems on the market. There are some good implant systems, and there's certain implant systems which I know are good, but it doesn't fit in with my working style. So the implant system that I've used, I'm comfortable with it. It fits in with my working style. And in addition to that, I'm happy with the data, the scientific evidence behind it as well. So you're absolutely right. There is so much to it.
It's really overwhelming. I've just found whenever I'm looking at, when I'm thinking, is it time to move up the gear and the implant stuff, I just get totally overwhelmed.
Come visit me at a day at Evo.
Hey, you're already around the corner, man, of course.
Yeah, come visit me a day. We'll spend the day with me. We'll sort it out. But it's like, Jazz, everything's overwhelming. You know what's overwhelming to me? Endo, on any level whatsoever. It's overwhelming. You know what else is overwhelming to me? Composites. Because I've not done them for such a long time now. The composites that I do, they're to fill screw access channels in implants, and I deliberately make them a different color so I can see them in case I ever need to retrieve it at a later date. So we can't be proficient at everything. Don't think that we can be proficient at everything. Is we can have a very good and broad subset. Because we keep going back to this super GDP. Who's one guy I consider a super GDP? Raj Alawalia. He does some absolutely beautiful, beautiful work. Okay, he sends us work to do here because he's just like, no, the setup that you guys have got there. This is just like my patients are going to be better off going there. So don't be afraid and don't be worried about saying to yourself, here's my limitation. I'm going to study to expand that. But also, if you say to yourself, here's my limitation, I'm happy with that because I want to do other things as well. That's absolutely fine. And don't let anybody tell you cannot do something. You've got to always put your patient's interest first, but it's a continual learning curve.
Amazing. Have you got time for one more question, Pav?
Yeah, absolutely.
Okay, so my last question is, if someone wanted to start their implant journey, maybe they're 2-3 years qualified, they've found their feet a little bit, they've progressed enough that they want the next challenge, is it right, this whole mantra of learn how to restore implants first? Or do you think they should be actually learning how to do the surgical aspect as well at the same time as doing the restoring? What is your beliefs and thoughts about this? It's commonly banded around about learn how to restore an implant first, then progress. Is that the right way, in your opinion?
You don't necessarily have to be proficient at restoring implants first. but you need to understand the restorative process first, okay? So there's two things that I would say to that. The best implant surgeons that I've seen understand restorative. The worst implant surgeons that I've seen do not understand restorative, okay? It really is that simple. And the other thing that a lot of people ask is, why is there no speciality in dental implants? Because it's too large and too complex a field, you know? Because if somebody turned around and said to you, right, we've developed a specialist training pathway, this training pathway is 15 years long, people are going to go, forget it, I'm not interested, okay? But what a lot of people start to discuss when they start to become proficient at implants is implants, it's a restorative, it is a prosthodontic process with a heavy surgical element. If that makes sense. So they're putting the restorative first. Why is that important, Jazz? Because patients don't want implants, they want fixed teeth.
100%.
So it's the prosthodontics that's more important, and the implants are just a method to achieve that. So understanding the restorative process is critically important. There is no reason why you can't learn the restorative and the surgical at the same time, but don't make the mistake, I'm just going to go down the surgical route, because you are not doing your patients any favors.
And what do you think about this whole concept of young dentists who can't section and elevate, then going on to an implant course? Like people who just can't extract teeth proficiently starting surgery? Because that happens a lot, I feel.
Yeah, you're gonna get your fingers burned, and they're going to be expensive mistakes. You need to start to, whether it's at your local hospital, get a part-time job, raising flaps, removing wisdom teeth, taking out broken teeth. You have to have those surgical skills, okay? If you can't take out teeth atraumatically, all that's going to happen is you're going to get your fingers burned, and you're going to get patients breathing down your neck. So patients are going to come in, they're going to turn around and say, why does this implant look like this? Why isn't this implant taken? Or what you'll do is you'll start a process and understand it's way more complex than what you thought it was going to be, and all of a sudden you don't have the skills to be able to help that patient. You need to understand that restorative process. You've got to start to build your surgical skills as well.
Amazing. Pav, you've raced through all my questions, but it's easily been 45 minutes, very easy talking to you. I think we've covered so much there. I think me and you are both naturally quite fast talkers, lend ourselves to podcasting and stuff. So I think there's about 90 minutes of content in this 45 minutes, I think. So I think that's been really good. Pav, thank you so much for your time to share about how your journey of niching down. I think it's going to inspire a lot of young dentists who maybe think that, oh, I don't know how to go about this, or that maybe they've left it too late. And I think your story is sensational. So thank you for sharing it with us.
No, and thank you, Jazz, for encouraging me to get into podcasting. I'm really enjoying it as well.
You're doing great things. You've had great. I mean, just the other day, I listened to Paul Homily one communication. You're a natural, Pav. You're a natural, and I'm enjoying it. And I think for those people who really want to learn more about implants, or you're already an implant geek, then Pav's podcast is the podcast to go to. So do check it out. Hit that subscribe button, and let us know what you thought of this episode when it's out.
And similarly, anybody listening to my podcast, please look at Jazz as well, because he does a lot of great stuff, not just focused just on implants, but on general dentistry, and it's the Protrusive Dental Podcast. So Jazz, it's great seeing your career progress from when I first met you a few years ago. I'm very happy for you. I'm very proud of you as well. And I think you are also a very good example of what passion can do for dentistry. So it's when people just chase the money, they're gonna end up unhappy long term. You've got to be passionate about what you do, and that obviously comes through in everything that you do, including your podcast.
Thank you so much, Pav. Thank you guys for listening all the way to the end. I hope Dr. Pav Khaire brought some value to you, whether you're considering dabbling into implants and you need that little kick up the bum to get started, or maybe you resonated with my story about hesitations about giving more time to implants because it might mean that you are having to focus less on other areas of dentistry which you enjoy. So I've actively made that decision to not dabble with implants or to not get into implants because I feel as though that is such a huge, steep learning curve. But I do feel after that chat with Pav today that perhaps there is a role in learning how to restore implants first and go follow that sort of pathway to be able to provide that service to your patients, because implants is just dentistry. It's another part of dentistry. It's another tool. If you enjoyed this episode, then do check out the Dental Implant Podcast by Dr. Pav Khaire. And just a bit of news for you. So many of you joined the WhatsApp group that we're kind of full, and I'm really gutted for everyone who didn't join the WhatsApp group, because we're getting messages all the time now saying, hey, what happens to the WhatsApp group is full. So we're starting a Telegram group, which apparently has a lot more capacity in a group. So I'll keep you posted on that. Do join the Protrusive Dental Community Facebook group to get updates for that. Now, the second bit of news I have for you is for those of you who've been messaging me about when we're taking the next cohort of Splint course delegates. Well, that's happening on the 7th of June as it stands. If anything changes, I'll let you know, but as it stands, it's 7th of June, and all you have to do to sign up is splintcourse.com. Just leave your email address in there, so when I'm ready to launch, I'll email you, and this time it's going to be a 2-week window, and I guess I'll email you all the different bits of information about what the Splint course entails, the monthly coaching, the Facebook group, the case support, the handouts, everything you need to know for it. So if you're interested in the Splint course and you missed out on the first cohort, do check out splintcourse.com, register, or DM me on Instagram or at Protrusive Dental, and I'll give you some useful information from there. Anyway, thanks so much, and I'll catch you in the next episode, same time, same place.